Hey, thanks everyone again for joining. We'll go ahead and start. And I'll just start by introducing myself as well as the think tank. I'm Bhav Jain, and I'm a third year medical student at Stanford. I'm joined here by my colleague and co-founder, Tej Patel, who's a Marshall Scholar at Oxford. Um, and we launched the Social Equity Action Lab about 2.5 years ago. It's now the largest youth-led movement focused on health policy research and healthcare reform. Over the last year, we've advised in two governors' races in the US, and we're now actively involved in House and Senate races as well. And our overall method is that we teach and train students across the world how to engage in health policy research and writing, and then use that as the basis to actually translate and advise those who are in government or running for office to actually improve health care overall. Thus far, we have over 800 undergraduate and graduate students, and our work has been featured in outlets such as JAMA, and the Lancet and Nature journals as well. So with all of that, we're so excited for all of you to be here with us. This is going to be a seminar in which we walk through the process that's worked well for us to actually write and publish op-eds, commentaries, and other opinion articles. And then we'll leave ample time at the end to also engage with all of you in an open Q&A style format. So with all of that, I'm very excited once again to introduce Tej and pass the mic off to him to start off our session here. Thanks again, everyone.
Great. Thank you again, Bob. And thank you all for joining today, this morning on the East Coast. So as the subject of our seminar today is essentially, we're going to walk you through how we think about writing and publishing commentaries and viewpoints. And just a brief roadmap of what we're going to be discussing today. So Bob gave a wonderful introduction of what SEAL is and what we try to do with our organization. But I think today we're going to solely focus on commentaries and medical opinions. So I will first introduce the types of commentaries and medical opinions we write in terms of the content as well as different lengths and outlets. And then we'll walk through more or less how you actually develop and write and publish these articles themselves. So we'll focus on how we choose and select an argument. We'll focus on how do we select and create a substantive draft. Subsequently, we'll also focus on trying to reach out to faculty mentors and what the right approach for that is. And then finally, we'll also go into how we go about pitching a draft to journals and then summarize all of that with a few key takeaways that you can essentially incorporate into your own research and writing. Great. So Bob already gave a wonderful introduction. So as Bob mentioned, I'm at Oxford right now. I'm studying global health and epidemiology, and Bob's currently at Stanford Med in his third year of med school. And our experience for commentaries and writing has really just kind of surveyed the entire gamut of healthcare, from things related to health policy as well as global health in certain conflict area zones. And we're really glad to share all of our experiences with all this writing with you guys today. Great. So just a general brief overview of the type of writing we'll be discussing today. So commentaries and medical opinion pieces, as you may already know, are just a brief subset of all of the medical writing that goes on in the space. And I think we can sort of think about this in two main facets. One is medical journalism in the sense that we'll think of more of the lay press articles, so articles for general magazines, for medical news outlets, and general websites on people's blogs, for instance. And then the focus of today's seminar is going to be more or less on scientific publications. So the viewpoints and commentaries we write for manuscripts, for journal articles, eventually inform research papers and larger clinical trials in the future. So our commentaries so far have been kind of focused on three main things, I would say. So one is critiques of existing and future health policy. So as you've seen in prior articles or posts, we focus a lot on payment models, public health systems, and generally how federal legislation has failed to either reduce or reduce the cost of healthcare and improve the quality of healthcare. And all of this is directed towards a medical audience. We also tend to focus a lot on global health and public health approaches. So this specifically as it relates to conflict zones, low and middle income countries, and just general international settings. And this is also for the medical audience. And then finally, a third sort of piece of writing that we do, but don't tend to focus on as much, is articles for the lay press. So it's general magazine outlets about things of general interest. So for example, mental health, vaccine policy, and more or less broader healthcare. And I also wanted to explain sort of why we kind of go about writing viewpoints and commentaries in the first place. So I think a good demonstration of this is our work in mental health care. And as the title of the slide indicates, this is exactly how we think of social action. So in a sense, a viewpoint is really nice, whether it's a magazine article or a medical journal article, in that it can actually lay out the sort of framework for your thinking on a certain given area. So as some of you may already know, I think there's a lot of hype and attention around the idea of digital psychiatry and telemedicine being able to actually fill up the mental health care gap and deliver care and resources in certain settings that aren't necessarily available. So both Bhav and Simmer, who is another colleague of ours, wrote a really nice article in the Smithsonian Magazine in May of 2023, detailing how a lot of new tools have emerged in the digital psychiatry space, but there hasn't been as much regulation or really scrutiny going on with these tools to actually make sure they get at the issue of helping to address patients' need for access of care and access for primary care. So as a result of this initial article, we were really interested in the idea of whether we can actually quantify whether broadband access is a key determinant of actually getting mental health care. So in a recent article that we essentially published the year following this initial Smithsonian magazine, we actually explored this question head on, and we sought to actually correspond whether access to broadband internet was actually associated with access to mental health resources. So in a very elegant analysis, we actually looked at data from all 3,100 plus counties across the US and tried to find essentially what the density of mental health care providers was in areas of different broadband access, and ran a controlled multivariate linear regression model where we actually can control for a variety of factors that may explain other spurious results. And we also were able to really elegantly show, like in a map itself, which counties in the US have broadband access and which counties also have a higher density of mental health care professionals. And overall, the main takeaway of this analysis, similar to what Bhav and Simmer wrote about in 2023, was that in areas that lack essential broadband access, there also is a corresponding lack of mental health support, whether that's density of physicians or just infrastructure in general. And this points to a bigger issue in that trying to actually bridge the digital divide, it might actually be more sensible to advocate for federal legislation that improves broadband access before actually hailing telemedicine as a panacea for healthcare access concerns. And that brings us to the third point of this slide, is that a lot of this work eventually will inform policy, hopefully. And at the time, a big piece of legislation that was under the purview of the Federal Communication Commission was the Affordable Connectivity Program. And the sort of nexus of this program was that it allowed a lot of low-income households to actually have a subsidy for affording broadband access, whether that's internet broadband or just simple like stipends to purchase laptops, computers, and iPhones, for instance, or phones, for instance. And a lot of this, for instance, gets at the idea that if we're going to actually create federal legislation and use our federal dollars to support these programs, they can also be used, for instance, to actually improve telemedicine access and also improve mental health care. Unfortunately, the ACP did end in June of 2024, but this was a very elegant example of how a viewpoint could inform a broader research question and eventually also support a current or developing policy in the American landscape. Great. And then I guess another good viewpoint topic that we can sort of focus on is value-based care and the payment models that at least the Centers for Medicare and Medicaid Services focuses on. So for those who are not US focused or are from an international audience, the Centers for Medicare and Medicaid Services is sort of the regulator of one of our public delivery insurance systems in the US, Medicare and Medicaid. And a big focus of this public insurance system is essentially delivering care to patients at lower costs and improved quality. And the way CMS goes about this is they run these individualized experiments where they trial new ways of actually paying physicians and to see if that actual payment itself can relate to better outcomes, both in terms of costs and quality. And real briefly, the way CMS breaks this into two different models is that there's something called a population-based model where essentially CMS will pay either hospitals, specialists, or primary care physicians to take care of a patient throughout the entire duration of their chronic care episode, or they can essentially pay them in an episode-based context where payments are essentially allocated based on certain surgical episodes or certain medical episodes. So real brief, the way CMS focused on payment innovation was either population-based models or episode-based models. And as a result of sort of all of this information and federal context that was going on, we thought that it was appropriate during certain aspects of the trials and experiments to actually offer comments and insights into how we think we can actually improve the process of creating new payment models and creating new healthcare delivery systems. So, these are good examples of articles we wrote throughout 2022, throughout 2024. And this really is a really good example because the way Centers for Medicare and Medicaid Services pilots these models is through like an iterative process. So they'll typically pilot a lot of these payment models in parallel. So as there are eventually like open periods for commenting on these models or open periods for iterating on these models, there actually is a really good opportunity for us to actually offer insights on how to improve this. So like the last point says over here, these models are oftentimes multi-year experiments. So we can really just apply any framework of quality improvement to their current thinking, and then also write these opinions both in medical outlets as well as lay press journals to actually improve the way CMS goes about improving healthcare delivery. Great. And then now I'll pass it on to Bob, who will explain the basic anatomy of how to write a viewpoint.
Excellent. Well, first off, thank you, Tej, for that wonderful overview of what the scope and impact of our work has been thus far. And I think now for the more interesting section on how we approach this from a really step-by-step fashion. And in fact, at the end of this, we'll show you a very, very real walkthrough of one of our articles and what each step, mapping on this, what each step of that specific article was as well. So first, for speaking about the general abstract process, the first step is simply deciding what it is that you want to focus your writing on, right? There's a whole host of issues that all of us have interest in, but at the end of the day, the best pieces are going to be characterized by those that have a sharp and crisp focus and argument. And so, in our opinion, the best way to choose something often has always been based off of the news cycle, because medical journals and even lay outlets are usually pretty interested in either accepting articles on an issue that's very, very relevant to the situation happening in the now, or they are also open to issues that are of fairly general relevance, even if that spans several months or several years. But for those kind of longer time horizon issues, usually it is helpful to be able to offer a really novel and substantively different argument from what has been otherwise offered. The advantage of focusing on an issue that's happening now is that you often have more of that first mover advantage. You don't have to have as radically novel of a lens because no one else has focused on that issue yet, at least in medical outlets. And so, as you can see on this example, we simply looked at the top news stories in the health sections from NBC and Wall Street Journal this week, and also looked at what's been accepted in the New England Journal of Medicine over this last week as well. And you can see a very, very sort of obvious link where the news stories are generally focusing on issues around vaccine hesitancy, looking at which states, which regions have the highest versus lowest vaccination rates. There's also some news articles on more of, again, what I would classify as kind of longer term of general interest, always issues like Medicare Advantage. And there's even one article as well on the FDA's revocation of approval of a flu vaccine. And so then when you look at what has been accepted in the New England Journal of Medicine, we're seeing articles on anti-vaccine shift and which factors that are actually affecting anti-vaccine shift may be managed, which ones might not be. That's by Rasmussen and Jernigan. And then you see one more article by leaders of the FDA, almost as a response to the large amount of news over these last several days on how they chose not to approve a new flu vaccine. So they also sort of wrote how they're thinking about shifting their drug and vaccination approval process as well. So in short, we think, especially if you're just initially getting started, there's no better way than to look at news articles, ideally in the last 5 to 10 days, and then also look at the top medical journals, whether that's JAMA, NEJM, Lancet, Nature, and see sort of, both what is being spoken about from that news, uh, all of those news articles, and also what's not been emphasized as much. Ideally, you want to find your sort of opening opportunity in what's not been emphasized. Next slide, Paige. So once you have examined the news cycle and developed a sharp sense of exactly what is of interest, at least from a lay audience standpoint, and then also tried to map out and see what is the opening from the medical journal standpoint. Then the sort of next major step is making sure that you're offering a really unique and interesting argument, because if you simply regurgitate what's already been expressed in either the news articles or in other similar articles which have already been published in medical outlets, it's going to be very, very challenging to have your article accepted. At the end of the day, these are op-eds, so they really rely on having a strong novel opinion that is substantively different and interesting relative to all of the other opinions being expressed either in the news cycle or in the medical journal space. And so that's where, we often encourage our students and those that we work with, and we do this ourselves as well, as read as much as you're able to on that issue at hand, right? So, you know, we have here two examples, or actually three examples, one on Afghanistan back when the regime had collapsed, one on Iran in the last few years, back when their regime was very overtly oppressing its civilian base, and then one on sort of the triple demic, which was an incident which occurred at the tail end of COVID, where there were three simultaneous respiratory viruses that were overwhelming hospitals. And so you can see how we not only, examined the news, the first news article that we found on the issue, but we would often read upwards of 15 or more articles on that specific issue. We would read across a whole host of sources, as you can see here, ranging from the New York Times to the an article from the European Union to an NPR news article. Having a wide area of different sources then helps you understand, again, how are different people framing the issue. What you'll often find is even in more objective news outlets, because they're after all written by humans, even they tend to inject or at least analyze the issue under some sort of broader framework. And understanding how are people perceiving and interpreting an issue is really important data to have in your mental model as you then seek to write the article itself. You also will naturally need to examine, 15 or more sources often, because at the end of the day, even op-eds in medical journals need references, right? We have to have an ample amount of citations, evidence-backed stats, even anecdotes based off of news stories to actually support the issue that's happening on the ground, and support why your argument makes sense. So in short, making the case effectively for your argument, whether it's trying to advocate for a specific policy stance, whether you are trying to argue that a system should be run differently, any such opinion is going to be more convincing to doctors, medical students, and others if they're supported by evidence. And then I think the last element that's on this slide, which I think we do a good job of in each of these articles, is not just speaking about what you want done, but how do you want it done, right? So from a really operational and implementation perspective, which is frankly where most healthcare reform falls short, that is going to make it novel. You need not even have the most novel idea from a policy standpoint, but if the way that you want to achieve that goal is novel, that's often enough. And in fact, many would argue that many of these challenges that we see and speak about in healthcare, whether it's trying to achieve universal health coverage, whether it's trying to train more doctors. These are all fairly well agreed upon basic ideas, and it's not necessarily necessary to, it's not needed necessarily to have a new idea on that front. But I think where the money lies is, can you articulate a vision that is novel for how you would actually implement universal health coverage? How would you actually implement the expansion of the physician workforce? That's often where many of our articles have found a wedge, in addition to examining news cycles and finding stories that haven't been effectively examined. Next slide. So now, once you have both chosen a topic of interest, which again may or may not be linked to news cycles, and thought about what sources and sort of evidence bases might you use to inform the argument that you have, we feel the next best step is really just to start jotting as many of your thoughts and ideas down on paper as you have. There's nothing better than trying to translate the unstructured ideas that you have into a more structured format, because as you'll see in the example we share at the end, and in virtually any accepted op-ed or viewpoint in medical journals, they tend to have a very well established structure. Some may even argue that they have an overly formulaic structure, but there is a structure that does tend to work best. And much like other forms of essays, that usually follows the form of having an intro that exposes the issue at hand and offers context as for sort of why is this issue urgent now, right? You have to, in the course of that short intro, sell and convince the journal editors and the audience that this issue is important. It's important now, and that you are going to offer something that's novel or unique on that issue that's important now. So those are more or less the three elements that you want to achieve in the intro. You also, though, as with any sort of good writing, want to offer some brief overview of what it is that you'll be speaking about in the rest of the article as well. And so that's where having a strong thesis sentence that alludes to what it is that you'll be arguing about at the end of the intro is very important. Then you'll shift into your body paragraphs, where you'll in more depth describe the different angles of the issue at hand. You'll, if you're speaking about a specific way of trying to implement a policy, for example, then you might choose to use that body to describe different features of that implementation. What should stakeholders and governments be thinking about as they go set out on designing and implementing this new bill? If you're instead speaking about trying, or if you're instead trying to critique a government for, say, oppressing its own people in the midst of other global and public health issues, you might have your body focused on what should other actors, what should foreign state actors do to help. But in both of these examples, the idea is still that your body should be linked with your thesis, and further elaborate, offer good evidence, offer good stats, details, really try to otherwise color the thesis that you had first offered. And even within each body paragraph, we like to offer sort of a mini thesis, right? So you have your mega thesis at the start, at the end of the intro, and then you will choose to subdivide or break that thesis down. Each of those subdivisions might be its own thesis, right? And so you can see here in this image that we end our intro by saying that we must redefine the value in value-based payment models to encompass the cost savings that are actually made for the beneficiaries. You must have a way of actually measuring the performance of your model on metrics that actually matter to patients. And then you must also effectively manage the upstream social drivers that affect health, right? And so then you can see in our first point under that, we sort of loop back onto the first element of our thesis that at the end of the day, most value-based models have not generated enough cost savings for patients. Even if some have for hospitals, most haven't for the end user. And so then we, will further try to embellish and color that mini thesis with examples and ideally offer our own path forward for how might you change that. So one more way of looking at this is that you're offering a status quo, what's happening now, and then you're trying to say what should be different, but grounding that in evidence and stories and um, basically also you may rely on sort of philosophy or broader scientific arguments as well, which have already been used. One more feature that we feel defines a great viewpoint is trying to actually show the reader how are you thinking about this issue in ideally a nice schematic. It can be quite dry for one to solely read through a written piece, but having images that really show in almost a framework or sequence, what would this look like in the field if it were launched? And so, just going back on one of our many CMS and value-based model examples, this image here on the left was basically a framework that we had in our mind of how might you improve um, the way that we sort of implement value-based payment models at a high level. And so by having it in this cycle, we are able to very, I think, explicitly show that this is that the process we're advocating for in our article is not a one shot or sort of one time method. It's very iterative. It has to happen over and over again. And each of those steps is linked with examples in those black boxes that show how might you actionably take one of the steps from the framework that we articulate in our article and use it to inform a model that a government or health agency might be leading. The example on the right is uh, similar in that it tries to sort of take the dense text from the manuscript and break that down into sort of the key issues. In this specific example, why are genomic classifiers not being used as much as they should be used in India? They're expensive. The Indian patient population is very heterogeneous, and often these are trained on Western or high income nation based patients. What are then the next steps? How might you fix that issue? And so this image, if one were not to read the article itself, they should be able to just look at these schematics and have a good sense of what is happening. This won't work though in every example. In our Iran and Afghanistan examples, and even at the end, I'll walk you through the writing process step by step for an article we wrote on the Bangladesh unrest that happened back in 2024. For those examples, we chose it best actually not to have a schematic because we felt that much of the article was actually grounded in anecdote, and it was more important for the reader to sort of hear the stories of people on the ground and use those stories to inform evidence-based implementation of policy. So this isn't a one size fits all, but we're just offering you options that you have that you can leverage on an ad hoc basis. And then the next step, and this is one of the sort of key steps that we at SEAL help with, is finding faculty mentors. We strongly believe, as an organization, in having these be youth-led efforts because there simply aren't enough youth voices out there in the medical or scientific literature. And so we generally will sort of work in small groups as students. Again, believing that we have really important, unique lenses on issues that ought to be shared to write our initial thoughts down. But then we also, of course, value the immense expertise, whether it's operational or implementation expertise or um, expertise that others have from their own other writings. We value that expertise to then inform and improve our work. And so we'll reach out to faculty because many of these people are busy, though it's very, very helpful if you have a solid idea in mind, right? And so that's where like the steps one and two, having an idea that's linked to news cycles and then having that first outline is very, very helpful. You may also think of working with or reaching out to other medical students and residents or junior faculty, folks who might be less busy, making sure that you engage them fairly early on in the process because very few faculty just like to be on something that they weren't really involved in. Whereas if you can draft a good outline that shows that you've done upfront work, but leave it open to feedback, leave it open to breathing and sort of life cycle iteration. That is also very, very important. And so this image here on the right just shows an example email draft. We'll share this afterwards, and we have one more example email draft at the end. In short, this email draft starts by sharing about what are we thinking about writing? How is it related to a recent article that this mentor had just written? Because that makes it of more interest if it's anyways linked to their expertise or their domain. We also then share a few other examples of work that we've had because that helps build trust that will actually get the job done.
Great. Thanks, Bob. And I'll even add by saying that a lot of this expertise could be found on like PubMed or just general news sources. For instance, if you're looking for faculty mentors, like it might be good to sort of understand exactly what spaces you want to be operating in and eventually use these services to figure out who the defined experts are. And like Bob said, reaching out early is super critical. Great. So I think one of the sort of most interesting slash important points of this entire process is how do you go about finalizing a viewpoint and eventually pitching it to journals? So in this little diagram over here, this is basically what the Journal of American Medical Association, or JAMA, classifies as either a viewpoint or a perspective. So as you can see in the description over here, like a viewpoint is a short opinion-based article that addresses one important topic in either of these medical fields. And as you can see, the requirements are kind of stringent. So in that you only have 1,200 words to make your entire argument, you have around 7 references at maximum to actually include in your submission. And then you can't have an authorship team of more than 4 authors. And I think this level of limitation is pretty standard across most journals in terms of like what the viewpoints may entail. So this just goes to show that I think it may be helpful to have, 1 or 2 really credible experts as part of your authorship team, just because one, it will basically open the door for you to actually, pitch these articles to these journals, but you don't want to have a lofty team of more than 4 authors, as many journals won't actually accept a submission that has more than 4 authors. In any case, if you think that your submission fits into a broader perspective, which is included in the second box over here, which includes a opinion-based commentary or larger overview, you might have sort of a larger word maximum, but might have the same sort of author restriction. So I think the big takeaway here is that every single journal that you essentially submit to, whether it's JAMA, the New England Journal, Lancet, whatever it may be, they're going to have specific requirements for how long your viewpoint can be, how big your authorship team can be, and how many references you can include at submission. So be extremely mindful of all of those things as you prepare a draft. And I guess 3 important tips that I think we've found helpful to be important throughout this process is that to get one of these articles in a top outlet, it generally helps to actually have an expert who either has leeway with the journal staff or is a credible expert in a certain field of interest, either testified in front of Congress or has other credibility, because that expert will essentially like be sort of the anchor in which your article is evaluated in. So for instance, if your expert or your mentor is an expert, say in like payment models and healthcare delivery, then it might actually help in this case if you're submitting to JAMA Health Forum, for instance, to actually have that person who's worked on payment models before to advocate for your article and be a key author for your paper. And then I think to sort of increase your success for getting into some of these top journals, it is also important to establish some sort of credibility or some sort of connection with editors and journal staff. Like oftentimes, some of our mentors have either been on the editorial teams of some of these journals, whether it's like JAMA Oncology or the main JAMA journal. And it's oftentimes really helpful for you to actually increase your success of getting an article in these journals by identifying certain editors in which you want to work with and finding those mentors who might be editors for these journals. So while it isn't necessarily a requirement by any means to actually have somebody on those teams, it definitely helps by actually having a good sort of rapport with the actual team in the editorial team of the journals themselves. And then, like I said, just be mindful of word counts, table numbers, figure numbers, and references as you prepare your article for submission. Great. So I think another really key important part of this entire pitching process is your idea of creating cover letters and pre-submission inquiries. Um, Essentially, a cover letter is what you will be submitting to a journal to basically tell them that your article is of interest, it meets their requirements, it's going to be essentially applicable to their viewership and their readership. So this is basically your first pitch and first point of interaction with the journal itself. And then in some cases, when you're writing viewpoints at very high impact outlets, it might be helpful for your odds to actually submit a pre-submission inquiry, basically stating that here is an article that we're going to be pitching, here's what our article entails, and here is exactly why this article is important for your readership. And I've kind of broken this apart into two key facets here. So the red outline or the red box basically illustrates the brief summary of our research item, which includes our thesis and our strongest lines of argument. So as you can see, the example of the left, this was a paper about trying to increase mental health screening tools amongst US colleges and universities. It was actually one of SEAL's first initial projects. And we wanted to essentially pitch this as a white paper in collaboration with MindWise. So we wrote a brief white paper to submit for the Journal of American College Health, and eventually wrote in the red box our main argument of actually having increased focus for mental health screening tools, in that there is a lack of specificity that address diverse health needs. There is an inadequate adaptation of screening tools to reflect the wide gamut of demographic and cultural variables that a college campus might essentially have. And there's also an insufficient integration of screening outcomes with the actionable support systems themselves to enact change. So that was the main crux of our article. And then as you can see in the green box that falls directly below the red box, we illustrate exactly why our contribution is important for the readership itself. And basically we showed that, we're a bunch of youth individuals with perspectives with youth mental health. And we think that our perspective could really help shine importance and shine light on an important area of youth mental health specifically. And as you can see for the right example, this was one of the papers that Bob talked about earlier, which is our response to how we can empower public health and public health advocacy in Iran following Mahsa Amini's untimely death. And we talked essentially about a lot of the important things that our article entailed. So how a public health approach is really important in areas of oppression or in countries where a regime has taken over, and how for instance, our perspectives from having people who are either Iranian citizens themselves or are big voices in Iran to actually be on our article is important for getting across that second loop or second barrier into actual publication in Nature Medicine, for instance. So I would argue that both of these points are extremely important when preparing either a cover letter or a pre-submission inquiry. And then real briefly, there's a variety of medical journals that you can submit to when actually thinking of the submission process. So as you might be familiar with, I guess the top 5 journals that come to mind are, the New England Journal, Nature, Lancet, JAMA Science. These are sort of journals with the highest H index, which I pulled from Google Scholar over here. And oftentimes, like this will be sort of like the holy grail of where to submit to. But in some cases where you're actually creating a very specific health policy or say global health article, it might actually be more like timely to actually submit to one of the more niche and policy focused journals. So in Google Scholar, for instance, I subsetted the top 10 journals for health policy and medical law and the social sciences. And as you can see, these top 10 journals that are displayed are totally different from the ones that are broadly displayed in the medical sciences category, and include things like Health Affairs, JAMA Health Forum, all outlets we've essentially submitted articles to. So I think the general advice boils down to, one, find the best journal that aligns with the scope of your article, of your viewpoint. And then also you want to also generally find an article or a journal that has a high-ish impact factor. And then, like I mentioned in the previous slide, if you know or have connections with the editorial team of these articles, like be sure to either send them pre-submission inquiries or send them emails beforehand saying that, hey, you're going to submit an article to one of these outlets. This will definitely help streamline peer review throughout the entire process. And then in the next slide, which I'll get into the peer review process, like be receptive to any feedback that these editors have and incorporate their feedback into your revised manuscript as you go about the process of iterating. And then generally, I think the sort of takeaway point also is that with the viewpoints, there always is the sort of sense that an outlet might not accept your work. So just be persevering throughout this entire process, like have resilience and keep on submitting your article to some of these outlets. And eventually there will be editors that find your work interesting and will give you the appropriate peer review to incorporate into your revised feedback. And then great. So I'll briefly go into just the process of peer review. So if you're lucky enough to actually get your article into the peer review process where reviewers are actually able to offer editorial feedback, there'll be a process in which a reviewer will give you feedback and you'll have to address their feedback in a point-by-point response letter. So in one of the articles we wrote talking about how we can revamp public health systems amid the triple demic, a sort of big kind of not necessarily flaw, but a big sort of comment that a reviewer had was that although they thought that our piece was a timely contribution to literature, they didn't feel that we talked about the termination of the public health emergency appropriately in the article, nor gave it enough emphasis. So they wanted us to expound upon that point further in a revised form of the article. So as you can see in this cover letter and response letter, we basically say that, we've addressed your feedback and we've done it in a point-by-point fashion. So as you can see in the right diagram over here, we basically give a response for which how we're going to illustrate how the public health emergency and the termination of that affected the overall response to the triple demic. So we talk about exactly how we're going to address the comment, and then also give line by line excerpts in the revised article itself, in which how we actually go about answering that comment. So for instance, we talk about the magnitude of CDC funding and how that was essentially terminated or during the triple demic. And then we also talk about some of the other surveillance systems and surveillance methods in which the CDC had in place, such as wastewater surveillance for RSV. That might also sort of be, adjacent and helpful during a time where public health emergency is terminated, for instance. So these are examples of how we found feedback or were given feedback by reviewers themselves and went through it methodically to eventually answer their feedback and incorporate their suggestions into our revised article. And then just to briefly summarize to summarize the entire process, I think the most important thing that you want to do is when you choose an argument, identify the most salient topics concerning health, medicine, policy, and then make sure you cross-reference with leading news sources, be it NBC, Wall Street, whatever it might be, because what you choose as your initial argument is probably the most important step of this entire process. And I think once you eventually choose your argument or choose the article in which you want to write, make sure you prepare a thorough outline that distills your argument into a key thesis, like Bhav mentioned, and then make sure you give each thesis point the appropriate evidence that it needs, which is honestly different from like a medical or honestly from like a lay press perspective, where I think your opinion matters a lot more than the evidence, just given that you're writing for a different audience. And then as you sort of can incorporate feedback and figures and schematics into your paper itself to help convey your argument where necessary. And then as you do this process, make sure you find faculty mentors early on in the process, really engage with them by sending them emails, ask for their opinions before you submit, because your faculty mentor, like I said, will be the anchor in which the journal essentially evaluates your work and might help give you more credibility throughout the process. And where you think pre-submission inquiries are necessarily helpful or beneficial, make sure you do that, especially for some of the higher impact journals like Nature Medicine that are more receptive to pre-submission inquiries. And then also lean on your mentor's expertise and experience in finding the appropriate journal, whether it's a niche journal or more of a high impact outlet, depending on the general relevance of your work. And then lastly, don't be sort of bogged down by peer review. Use it honestly as an opportunity to strengthen your article and the overall messaging. The editors are essentially just there to increase the sort of applicability of your article and also improve the readership. So don't take peer review in any sort of bad light, and be resilient. Use it as an opportunity to improve your article and make sure it essentially is applicable to the masses that you're targeting with. So if you take these points into mind, I think it'll be very seamless to actually take an idea that you have as an argument and incorporate it into like a medical article that you can publish into one of these top journals.
Yeah,
And
and I'll
if
just also
helpful,
add
yeah, go ahead.
on that last note of sort of being resilient. I mean, we've had articles which have been rejected upwards of, you know, 10 to 15 times. And we've used each of those to really understand why were they rejected, how might we further improve them based on any feedback that they have. If they have, often the journal will simply desk reject it, which means that they don't give any feedback at all, but you might get lucky and you might get some. But even after having certain of our articles
Yeah.
rejected 15 or more times, they were still eventually accepted. And so just know that there's a lot of really solid journals out there, and this is a matter of being very, very
Yeah. It's a numbers game after all. So just, yeah, keep on being resilient, keep on submitting despite rejection. Great.
So,
And next, I'll pass it to Bob to walk through the example that we prepared.
yeah, I was actually thinking, just being mindful of our time here. Why don't we take some audience questions at least for the next 5 or so minutes, and then we'll save
Sure.
the next five for what I think is a really, really interesting and exciting walkthrough of how this looks like from step one. But feel free to raise your hand if you have any questions based on what we've discussed thus far, and we'll just answer a few of those now. Yes, go ahead, Lisa. I may have to give you unmuting access. 1 second here. Let me change that. Uh, okay, now it should work. Go ahead.
Thank you. Thank you again for a really useful workshop, giving details that we necessarily don't know as much about. I had a quick question about the news relevance of the articles. So there's something I wanted to work on for some time. It's not in the news too much, but it is a very important issue to speak about. Do you think it's sort of unpublishable because it's not spoken about a huge amount in the sort of general media?
Yeah, so I would say, like, generally, the things that are really relevant in the news have the highest chances of getting into the top outlets, just because those are issues that medical journals want to make sure that they're also having some analysis and commentary on. But by no means does that imply that if you don't choose something that's linked with the news cycle, it won't be accepted. It might not land in the highest journal. It still might, though, right? If you're offering a really novel and unique lens on that issue that hasn't been explored, even though on those issues, ideally you should link it to why it matters now, right? So if you're looking at a law that was passed a decade ago, it's not changed since then, but is there something more recently that's actually made analyzing that law more important, right? So think of novelty from many perspectives. Obviously, the most obvious and I think easiest when initially getting started is just looking at the news cycle. You can also think of novelty as new perspectives or linking old perspectives to new issues as well. I'll
Uh,
also just add on that note, if you do choose to link something with the news cycle, it's then often very advantageous if you can reach the stage of submission fairly soon. So that may mean that you have to invest a lot of effort and really mobilize a team in as little as a week. But if you can try to get things to the editor's desk in, a few weeks at most from the time of the initial news article itself, then I think that also makes it more likely it's accepted. Tej, anything else on that front?
Yeah, no, I think you covered most of it. And I think even for some of the niche journals, like I mentioned earlier, I think you'd be surprised to see some of the topics they talk about in their commentary section are topics that are like a lot older or haven't received as much news just because it's a lot more of a specialty focused journal. So I wouldn't be bogged down by the fact that maybe a high impact outlet isn't considering it as like, high impact because it's not a recent sort of news development. But I would say look at like the wide variety of journals there are essentially available or and you can submit to and figure out exactly like if there is concordance between the ideas that you have and sort of the kind of wide variety of things they publish. And if there is, then always there is a possibility of you having, an article land in that outlet. So I wouldn't be discouraged by that.
Thank you. Thank you very much.
Great. I see Adrienne as well.
Hi, okay. So first I want to say sorry, this is like a long-winded question, but bear with me, there is a question in there. So more of like a practice thing. Like I'm just a first year med student. I have not worked in the medical field. I have like no experience in policy, but like I would want to become more educated on and then be able to make an impact on these kinds of things through the kind of work that you guys are doing. But like what sources, news sources are you keeping up with? What sources are you citing when it's something like it is important actually to protect the health of other human beings in like another country whose regime is being oppressive. How do you operationalize your goals when you're, I don't know, I guess maybe you're not so new to this realm, but like when you are so unexperienced?
Yeah, well, so I think the walkthrough that we'll do after this will hopefully answer a bit of that. But I think as for news sources, I think it's very, very helpful to choose at least two high quality news sources of differing lenses, biases. and sort of read them on a fairly frequent basis, ideally every day. So like I'll often read, Wall Street Journal, which is tends to be a bit more conservative leaning, and I'll also read your BBC's, CNN's, other what I think otherwise tend to be more left leaning outlets. But I think even more important than that is actually just reading JAMA, NEJM, and medical outlets, because you want to start to develop a sense for how do physicians and healthcare professionals and health lawyers and others in this discipline, how do they interpret issues, right? How do they actually write? Which I think is in some ways quite different from how journalists write. We use the journalists' articles in news sources for informing the evidence base on the issue, but then we try to write more like how the field, the health policy, health reform field writes. So I'll show you though the walkthrough in just a moment here. I think that'll help expose a bit more of this. We'll take one more question now, and then we'll start the walkthrough.
Bob, there's a question in the chat by Suvisha. She's asking, how would you recommend reaching out to faculty or mentors if you have an idea or even a draft of an article ready?
Yeah, Tej, if you want to.
Yeah, I can take this one.
Yes.
So I'm assuming that, the draft or like an outline is already prepared. I think it's as simple as just sending an email illustrating why you think their expertise would help you land that paper in a certain journal that you have in mind. As you can see, like in a previous example over here, this was an example of an email we sent a mentor of ours, what we can essentially do with our paper. So we read one of his recent JAMA articles, and we thought that our new article that we're writing right now actually was a nice dovetail of that initial article. So we mentioned that directly in the body of the paragraph itself, and then essentially concluded that paragraph by saying that we think your expertise would be wonderful to actually have on our new paper because you've written this initial work that kind of framed the initial like groundwork of our thinking. And then I think like an email like that, for instance, is probably the best way to go about it. You can always offer like potential outlets that you might want to submit to, whether it's like, JAMA Health Affairs, AJMC in this email or other outlets, depending on your work. But I think if you already have a like deliverable that's prepared, whether it's an outline or some sort of initial draft, I wouldn't wait. I would just sort of email the faculty mentor and see what their perspectives are. And be sure that like you connect the email to some sort of work that they've done in the past, whether it's an article they've published or a research area they lead, because I think having that concordance between the work that you're doing right now and the work that their expertise is based in is extremely helpful in actually making a strong argument to have them as your mentor, if that makes sense.
Great. Yeah. And I don't think it tends to be transactional, especially if you involve them in the earlier phases. I'll start this walkthrough now, which will show you exactly how we engage with a, this example is one who was a mentor of mine in the sense that he had actually taught one of my courses at Stanford, but I hadn't worked with him. And by engaging him early on, it felt like a very sort of two-way open exchange rather than a transactional one. So this example will be for an article that I was involved in back in March of last year on the health impacts of political unrest in Bangladesh and steps forward, which ended up being published in Medicine, Conflict, and Survival. So I'll share my screen now, and I'll sort of walk you through step by step how this looked. So as we've sort of already gone over, first step is having an outline, which I'll show you, and then sharing that with someone who you think might be interested. Might be one of your existing mentors that you have a relationship with, might be someone that you have not. I think either way works fine, so long as you explain why you value their insight. I think people like to hear that their expertise is relevant, and so we, even mention that we are reaching out, given his expertise on how you operate health care delivery in unstable conflict zones. But we also speak a bit about what is the article on, back to the issue of making it urgent. Why is it important now, right? There's over 400 people who've been killed and 8,000 who've been arrested. So giving some sense of urgency. And specifically the outline that we shared with him was this. So we start with our intro. We speak about the acute health impacts. This is mostly just trying to summarize what the news sources had already said. So it's not the most novel part of our article. That then more so, um, we speak about why is this dangerous? This again expounds more on the urgency issue. But the novel part is here, where we speak about how to address the crisis at hand. This is what no one else had been speaking about yet. You may have seen some of these ideas been spoken about in bits and pieces, but no one had given a full cohesive roadmap in one document of what are the steps that need to be utilized here. And so we speak about um, how we can work with other stakeholders like WHO, MSF. We actually, in this first outline, had many other examples that we thought might inform the response in Bangladesh, be it from Gaza, Ukraine, Somalia, Myanmar, Syria. Um, we ended up not actually having all these examples, which I'll speak more about afterwards. But then we speak a bit more about like based on specific stories and anecdotes happening and issues that are being brought up against Hindus or other marginalized groups in the nation, what might other specific steps be to address that? So both offering like high level steps as well as more micro steps for more unique features of the issue. And so after we shared this outline with him, he shared a few of his thoughts. I think most interestingly would be one on not necessarily making this a head-to-head or one-to-one comparison with the examples from the other regions that we had shared because it wasn't overt war as much as it was sort of just more of a civil unrest. And so those examples may have not been the best. And then he also sort of gave us this lens of thinking through how more than the immediate civilian toll that was happening that summer, the longer term damage worth emphasizing is development in reverse. How this sort of civil unrest, be it from war or from political violence, often actually erodes many of the key democratic institutions that were only built over decades, if not several centuries. And so what we then do is in our second, so this over here was our first draft, and then our second outline, basically, you can see that we still keep many of those same anecdotes and stats of what's happening on the ground, but we add this whole section on what are the dangers of this escalating violence. We speak about how civil war is development in reverse. We also sort of shrink down our examples. We keep Myanmar, but we add in Sri Lanka, which we example because they also were not so much war as they were civil unrest in the setting of political violence. And then we remove the other examples because we thought that having it more tightly focused on those two examples would make it easier to understand. And so we shared this draft back with our mentor, and then our mentor, so we share sort of how did we address the mentor's feedback, and then the mentor gives us even more feedback. And I think this is great. This shows that there's a true, genuine two-way exchange happening. And so the mentor shares with us, like, is the Hindu part really the primary focus of the unrest? Should we actually have humanitarian corridors from MSF and WHO, or is there risk in that because you would then be challenging that nation's sovereignty? And so we then address that by basically focusing, or we remove the references to having those humanitarian corridors. We actually, though, then feel free to sort of stand firmly in our view that it is worth keeping the element on the attacks against Hindus because there have been over 200 such attacks. And so, I leave this in because it shows that, again, it's meant to be a two-way exchange. You don't and should not do everything exactly as your faculty mentor asks of you. And I think the best faculty mentor are open to having that exchange, right? It's that I think is a very important aspect. And so it's because we mentioned this that then our mentor came back and actually agreed with us that leaving in that Hindu angle is worth doing so. And so in the final article, which maybe I'll have Tej go back and share his screen on, or actually I have it. Yeah, that's the screenshot, but actually I have it here. So you can see in the final article, many of those themes are still there. We still open up with describing many of the issues actually happening on the ground, many of the attacks against civilians. We speak about sort of what are examples from neighboring regions that may inform the response efforts here, using again Myanmar and Sri Lanka and not the other examples. We also, I think, have that part on development in, yeah, so we have this bit here on how civil war is development in reverse. All of these are ideas and themes that our mentor had suggested to us, and this piece only became as strong and as comprehensive as it did because we had that really sort of productive two-way exchange. So this, I think, is a great example of how you go from an initial idea, an initial outline, to actually that full draft with insights and the sort of lived experiences and perspectives of others who have expertise in the space. And so we ended up having a team of both Americans and Bangladeshis who are involved. So that is our example. Happy to hang on for 5 more minutes, just answer any outstanding questions that folks may have, if that's helpful as well. And if so, feel free to raise your hand and we'll address them. Yeah, go ahead, Sindhu.
Hi, thank you both again for walking through this and providing so many examples. I think my question is a little bit focused in medical research and the field of medicine generally. I think your examples with social change or commenting on the global scene and conflict is a great example of something that feels accessible for almost anyone to read and learn from, maybe share an opinion on. But I think a place that still feels really ambiguous is in medical research, where a lot of these articles seem to be conversations between researchers or conversations between physicians and stakeholders, or physicians and other physicians. And a lot of the discourse on making this more accessible to the general public has just been about jargon and using better language. But I'm wondering about Olive or any of your thoughts from the team on the role of commentaries in addressing the general public directly, specifically on medicine and medical research. I think cancer is an example where it feels like there's articles coming out every single day about a new treatment or where we've picked up from where we've left off on a particular cancer, all the way from in vitro wet lab work to something at a clinical trial scale. And I'm just kind of thinking as a patient, trying to navigate all of that and synthesize all of that. What sort of the role that you think either now or in the future of commentaries working to sort of address that and prevent all of the work that you can put out from saturating the space and just creating more articles and more op-eds, and more so kind of targeting how do we explain the why of why does this research matter, or why is this pipeline for this one treatment in this cancer important for the general public to know about, beyond just updates, if that makes sense. And just any thoughts that you have on that.
Yeah, I mean, I can start. So I think you bring up a lot of wonderful points. I do agree that sometimes like viewpoints are a bit inaccessible to the public depending on what they're written about or what topic they focus on. But I think it's important to keep in mind that, you know, the sort of work doesn't end with the viewpoint itself. Like oftentimes the way I view it is that a viewpoint, even though it might be caught up in certain jargon or might be very exclusive to some sort of audience, is just your plan for exactly how you're going to attack a problem. So, for instance, like going back to the mental health example, like I think the example that Bhav wrote in the Smithsonian magazine was an instant of how digital health tools are springing up out of nowhere, like in such a great magnitude, but no one essentially knows if that's actually going to solve the problem of telemedicine. And I think articles like that, whether it's a viewpoint or like a magazine article, only should be like used to like get the idea across to then support larger studies, whether they're retrospective studies or clinical trials that really get at the issue head on through like causal methods. And eventually, if that pathway is followed, those causal methods can eventually lead to policy, lead to approvals of certain drugs. But ultimately, the end goal is that the viewpoint is the starting, it's the foundation for getting your ideas. And I wouldn't argue that, you can write a lot of viewpoints, you can write a lot of op-eds about certain issues, but it's even more important to take those ideas from the viewpoints themselves to inspire other more larger perspective examples of research, and then translate those research articles into either policy, into approved drugs, into approved interventions, whatever it might be. But I think it's being intentional about the entire process and just using viewpoints as a springboard for your ideas. I'm not sure, Bob, if you agree, if you want to add more onto that as well.
Yeah, I also think it's just important to understand the purpose and the intended audience of these journals, where usually medical journals are most read by physicians and other healthcare professionals. And so naturally the way in which you write your article, if you want to maximize scope within that venue, should be likely more academic and more tailored to their experiences. But there's other venues that are better for engaging with the masses. I think one is certainly social media, and we need more people on social media who will sort of be the guardians of evidence-based knowledge. Even just going back to the mental health example, this article was in Smithsonian, which I had helped write, and it was meant for a bit of a more general audience than your sort of average medical outlet. As you can see in how it's written, it's a bit more sort of engaging and fun to read. It's more based in imagination and visualization. It still has a lot of evidence, a lot of stats, but we tried to engage a much wider audience here. We share like what are the existing digital psychiatry or mental health tools that are being used right now. But it's written in a second person, very friendly voice. We still have the same sort of though theme of eventually speaking about like what may need to be done to ensure that these tools are launched in a safe and ethical way, right? So there is an argument still here, but it's not the focus of. Someone's on mute here. Okay, there is still an argument here that is sort of meant to be examined and analyzed by the reader, but the argument isn't the core. I'd actually argue that the core are the anecdotes, the interviews, and the sharing of the landscape of what's out there with the more, I'd say, perhaps general American audience or general online audience. So that's just one more thing. Try and use a variety of mediums and outlets. Don't just stick to any one. I see that John has a question as well.
Yeah, thank you so much for a great presentation. I also think it's great that you've gotten to collaborate a lot on the pieces that you've written. So my question was, as students kind of like beginning to engage in the space, do you tend to posit yourself as like a student and kind of highlight the fact that you've got the viewpoint of a student, which is obviously like a unique perspective on a situation? Or is it more important to say, here's why I'm a subject matter expert in this particular niche thing? And I don't know, yeah. So like, how do you approach that?
Yeah.
I mean,
Go ahead, Tej.
sure. I think it totally depends what you're writing on. Like, the example I gave about youth mental health screening, like it only was to our benefit that we were actually like, college students at the time having like firsthand experiences of mental health screening tools and the lack of integration with actual support systems. So in examples where like the benefit of having a youth perspective is useful, I would argue we definitely lean into that and advocate the idea that, we're students, we're still sort of in the space, we've seen things with our own eyes. But in other spaces where you're sort of writing for more like technical audiences, so like some of the articles we wrote about like payment innovation, for instance, like I think it's hard to develop a student focused perspective on those issues. And I think oftentimes they expect you to actually have some sort of level of context that's already established. And in that case, I think it's probably more important to kind of come off as a quote unquote expert, even though, we're far from experts in these spaces. But I think it's helpful to have a faculty mentor who knows a lot more about the space than we do, who can give us credibility in some cases, just given that we're not practicing doctors or policymakers just yet. So I think, just to summarize my answer a bit, I think it totally depends on what you're writing. If a problem is like super technical, for instance, and requires credibility from like external doctors or physicians or policymakers, then I would argue that it requires us to have a more complex like a viewpoint and perspective. And if it's more of like a student focused issue, then we tend to lean into it a little bit more and use our student perspective to actually make it more credible for us to pitch that idea, if that makes sense.
Great. Any other questions? I think we have time for one more and I see there's many in the chat, so we can take one of those if no one wants to raise their hand. I see that Meghana had asked one on uh, advice for students from more traditional medicine systems who want to publish in high impact journals. That's an interesting one because many of the, and this is its own issue in itself, but many of the high impact journals do have Western biases. There's obviously some that are global health focused, like the Lancet or Nature family of journals, but certainly JAMA, NEJM are by design American journals. And so what I would say is for sure focus on the more global focused ones if you are trying to write about a more traditional health system or certain medical practices that aren't yet in the mainstream of Western medicine. I also think many of the same principles we spoke about of like, why is this issue important? Why now? Why is it urgent? You can still apply here, right? So is there a practice in a more traditional health system that actually does make sense to further scale and disseminate elsewhere? I think one example of this is just we've seen in the mental health movement, there's been a renewed focus on practices like mindfulness and spirituality, many of which are from Eastern societies, but were long ignored by the West. Now these are actually becoming mainstream parts of how mental health care and psychiatry in the West operate. And so if you can try to find linkages where they exist, that would make a Western biased audience or journal interested, I think that's also helpful. So with all of that, then we will wrap up. I know that Parisa, who's our director of research, has shared her email in the chat. She is the best person actually to get in direct contact with if you want to start working with us. We work with many students on helping support their efforts in research, both on original scientific research, but also with opinion pieces and commentaries. I'm also going to repost the links to join our Slack and our mailing list. If you aren't yet on either of those are also very, very important to join because it's on our Slack that we now have more than 25 smaller um, group channels actually active in which students and others are working on various op-eds. And so once you're on our Slack, we either can loop you in and add you into an existing group or help you make a new one. But that's where we handle most of our sort of work and organize and schedule meetings. So certainly join that. The mailing list is where we'll share future events, much like this one, other research and writing events, as well as other seminars in which we will go into more aspects of the research and writing process. And then lastly, we have a lot of work, as I mentioned earlier, going into actually advising key stakeholders on healthcare reform, much of which is informed by our own writing and research. And so if that's of interest, you'll find more information on that through the Slack and mailing list. I'll just pass it back over to Tej for any other
Yeah.
last words as we wrap up here.
Yeah, I mean, I think what Bhav said pretty much encapsulates all of it. Just be on the lookout. We're going to be posting this recording on YouTube as well, so feel free to review it on your own time if you have certain areas that you'd like to discuss or review again. Like Bhav said, join the Slack. That's where we do most of our communication. And Parisa is probably the greatest contact to reach to organize research or commentaries. And we have many, many teams across the entire space of healthcare working on writing across commentaries and research articles. So just keep in touch. And if you're interested, I'm also happy to share my email as well if you have any direct questions. And I'm sure Bhav is also happy to do that as well. So we'll drop that in a follow-up email to all of this. And if you have any questions, like feel free to contact us directly or reach out to us on Slack. We'll be free on either sort of medium to answer any of your questions.
Great. Thank you so much again, everyone. Really appreciate it. Have a great rest of your weekend. And we are really looking forward to hopefully working with many of you in the weeks ahead.
Thank you so much.
Thanks again.